Well, today is Wellness Wednesday, and the investigation into the largest cyclosporiasis outbreak in the U.S. continues. Since May 1st, the U.S. Centers for Disease Control and Prevention has received reports of more than 4,100 lab-confirmed domestic cases of cyclosporiasis from multiple states. The agency says it's also aware of more than 7,400 additional cases that are not yet confirmed and require further investigation. Taylor Farms has been voluntarily removing all iceberg lettuce sourced from central Mexico from the U.S. market, saying the company, says that it has the potential to be contaminated with the parasite. Meanwhile, experts say outbreaks like this one could have major mental health consequences. So in today's Health Minute, Mandy Gaither has more on the difference between food caution and food phobia and ways to take reasonable precautions without letting food anxiety rule your life.
Each week in the U.S., the CDC says it can coordinate up to 36 investigations into foodborne illnesses involving multiple states, whether it's due to germs like E. coli, salmonella, listeria, or a 9-state outbreak of explosive diarrhea from the cyclospora parasite.
It sets off an alarm system in the brain.
Clinical psychologist Susan Albers with Cleveland Clinic says taking recommended precautions like washing food, avoiding specific produce of concern, and staying updated on credible recall information are all healthy reactions that match the risk.
Food phobia or extreme anxiety goes beyond the normal level of concern or caution. It begins to take control of your life.
Albers says examples of this include avoiding restaurants, food preparation, or grocery shopping, having extreme intrusive thoughts, repeatedly and excessively checking for recalled foods, feeling anxious every time you eat, or throwing away food that's not related to the danger.
Focus on the facts, not the fears. Check in with credible sites. Avoid doom scrolling.
Albers says people who already have health anxiety, obsessive compulsive disorder, and those with disordered eating or an eating disorder may be more vulnerable to food phobias around these outbreaks.
If you notice that your behavior is changing to the point it is affecting your health, your emotions, your relationships, this is a time to check in with a therapist.
For Health Minute, I'm Mandy Gaither.